video.
Got it.
Okay, very good. So I'm going to make you now.
Hello, everyone. Welcome to today's Nicaragua webinar entitled Nicaraguan Programs of Maternal and Child Health, a Cross-National Comparison. My name is Barbara Larkham, and I'm one of your co-moderators today. We'll hear from our three speakers in a few minutes, but first we have a few other comments and announcements. Natalia?
Hi, everyone. I'm Natalia Borudinska, your co-moderator. I had the privilege of co-organizing and participating in Casa Ben Linder's first Women's Brigade to Nicaragua in 2023, where we learned about the country's remarkable advances in maternal and child health. So I'm very happy to be welcoming this webinar today. We want to thank Yoav Elinevsky for providing tech support today, as well as our many organizational co-sponsors who will be listed in the chat. You'll see several buttons available at the bottom of your screen. One button is for closed captions, so you can just click that to turn it on. Also, feel free to use the chat function to offer comments throughout this event, but to keep it working in service of the webinar, we ask you to use it in respectful ways that don't distract from the program. Demeaning comments about an attendee, speaker, or moderator will not be tolerated. Today's chat monitor is Arnold Matlin. Please direct a message to him if you have any concerns about comments in the chat. Also, if you have a question for the speakers, please don't put your question in the chat or we may not see it. Instead, please click the Q&A button and place your question in the Q&A box. We'll select your questions from the Q&A to pose to our speakers. This webinar is part of a monthly series about Nicaragua. Please mark your calendars for Sunday, June 22nd for the next webinar featuring a recent official Veterans for Peace delegation to Nicaragua. Speakers will include delegation leader Jerry Condon and 6 other members, co-moderated by Camilo Mejia, a Nicaraguan citizen, U.S. veteran, and former prisoner of conscience. You can register at bit.ly/Nica June 22. That's with a capital N and capital J.
This webinar is being recorded, and the recording will be sent to all registrants within the next few days. When it's ready, it will also be posted on the website of the Nicaragua Solidarity Coalition. That's nicasolidarity.com, and also on its YouTube channel. We also thank the Activist Network for posting it on their channel. If you'd like to become more active in supporting Nicaragua's sovereignty and opposing foreign interference there, please join the International Nicaragua Solidarity Coalition. You can check their website regularly for updates and new resources at nicasolidarity.com. You can also subscribe to the newsletter, monthly meetings, action alerts, and other notices from the Nicaragua Solidarity Coalition by subscribing at bit.ly/Nica subs, that's with a capital N, capital S. The next general meeting of the coalition is on Monday, June 9th. The coalition meets on the second Monday of each month at 2:30 p.m. Eastern Time. This is a special announcement. Nicaragua has stood firmly in solidarity with the Palestinian people, including the participation in 2 lawsuits at the International Court of Justice. Now, the Nicaragua Solidarity Coalition is a signatory, with over 700 other organizations so far, to a unified call to confront famine in Gaza, launch the diplomatic humanitarian convoy now. This convoy would be accompanied by diplomatic missions from various nations. We strongly urge you to ask your organization to sign this unified call. The link to the call will be entered now in the chat. We're also putting other links in the chat to subscribe to the NicaNet email list and Nica Notes and download ebooks about Nicaragua.
So now we'll turn to today's program. We'll hear from 3 featured speakers, followed by a Q&A session. We encourage you to enter your questions in the Q&A box throughout the webinar. Our first speaker is Becca Renk. Originally from Idaho, she's lived and worked in Nicaragua for 25 years and directs a health clinic in Ciudad Sandino, outside of Managua. She also coordinates delegations to Nicaragua through Casa Benjamin Linder and participates in other community development projects as a member of the Jubilee House Community Center for Development in Central America. Welcome, Becca. You have the floor.
Thank you, Natalia. It's nice to be here with you all today. I'm going to go ahead and share my screen so that we can see some photos of what Nicaragua is doing with the with regards to maternal health and child health. So Nicaragua's biggest holiday is coming up on May 30th. Bigger than Christmas, Easter, or even the Feast of the Immaculate Conception, Nicaraguan Mother's Day is taken seriously. It's a mandatory paid holiday, a day when Nicaraguans celebrate the holiest of holies, their moms. This week, Nicaragua's government released a statement about the day. It read, "Honoring mothers and declaring their day a national holiday is a duty and responsibility that we assume reverently, knowing that our blessed Nicaragua, mother of us all, forever dignified, sovereign, and free, celebrates this date with visits to the communities, towns, and municipalities where we reunite with our mothers or visit our mothers in their holy resting place, where we offer flowers and songs in accordance with our culture of love and peace." Around the country, people are preparing to celebrate their moms with gifts of food, cake, and piñatas. But honoring mothers is not just lip service paid one day a year. Nicaragua honors mothers every day in tangible ways, like by taking care of women during pregnancy, birth, and after. While the tradition of honoring mothers goes back many generations, this focus on maternal health is relatively new in Nicaragua. Prior to 1979, Nicaraguans lived under the repressive Somoza dictatorship. Most people were manual laborers with no rights, working land they didn't own. Babies were born at home with only occasional help of a lay midwife. I've met many women of this generation who speak about giving birth alone and going back to work in the fields immediately afterward. In July 1979, the Somoza dictatorship was overthrown by the popular Sandinista revolution, the insurrectional uprising that had been led not just by men, but also by women. From 1979 through 1990, the Sandinista revolution led Nicaragua into a new era with particular gains for women. For the first time ever, there was access to universal free healthcare, free education, mandated paid maternity leave, and free childcare. These gains for women became targets of the contra-guerrilla counter-revolutionaries, funded by the United States, who attacked healthcare workers, literacy workers, health clinics, schools, and teachers. After 10 years of the U.S. proxy war, more than 30,000 Nicaraguans killed, and a crippling economic embargo, the United States made it clear that the war would end if Nicaragua elected its hand-picked and funded presidential candidate, neoliberal Violeta Chamorro. In 1990, Nicaraguans went to the polls and voted for peace. Over the next 17 years of neoliberal government, women were once again isolated and denied their basic rights. Healthcare and education were effectively privatized. It was during these years that I moved to Nicaragua, got pregnant, and gave birth to my 2 daughters, which I chose to do at home and had the privilege to do under a doctor's care. This was because at that time, healthcare had essentially been privatized, and conditions in public hospitals were so bad and health services were so scarce that people literally died outside of hospitals for lack of care. In 2006, Nicaragua once again elected a Sandinista-led government, which has been re-elected on 3 subsequent elections. During the past 18 years of Sandinista leadership, I've seen how the government in the second phase of the revolution has set about restoring Nicaragua's rights, with particular emphasis on women's rights. Worldwide, pregnancy and childbirth can be dangerous, but we know that 80% of maternal deaths are entirely preventable. Nicaragua has proven this. Despite being one of the poorest countries in the Western Hemisphere, since 2006, it has managed to reduce maternal mortality by 79.8%, reduce neonatal mortality by 62.5%, and to reduce infant mortality rates by 58.6%. Through the country's universal free healthcare system, all prenatal, childbirth, and postnatal care in Nicaragua is offered countrywide free of charge. C-sections, premature births, neonatal ICU stays, and incredibly, even fetal surgeries are all free. Nicaragua is the only Central American country offering this type of surgery free in the public healthcare system. Home births, previously common, especially in rural areas, are now nearly unheard of. 97% of all births are in hospitals. In rural communities where I work, lay midwives who once attended home births have now been incorporated into the healthcare system to provide prenatal care and in-hospital birth support. In Nicaragua, 75 hospitals have been built new or remodeled since 2007 to make giving birth in a hospital a possibility even for rural families. Respect for Nicaragua's diverse cultures has been incorporated into new hospital birthing facilities so that Indigenous women can safely give birth squatting or standing up, the way that women in their communities have traditionally given birth. For those who still live far from hospitals, a network of 201 maternal wait homes around the country provides space for more than 72,000 women each year. In 2024, it was over 72,000 women to stay near a hospital for the last 2 weeks of their pregnancy. Food, housing, and vocational training is provided free of charge. Women rest and are checked by medical staff regularly, and when they go into labor, they give birth safely in the hospital next door. Magda will be talking more about this model in a minute. Postpartum, Nicaraguan women and their babies receive free quality health care, and working women are guaranteed full pay maternity benefits. Last month, the maternity leave law was increased from 84 days to 91 days of mandatory paid leave. Free daycare programs around the country provide care, meals, and preschool for babies and children up to 6 years of age so their moms can work. Today, Nicaraguans have much better access to perinatal care than my home state of Idaho. In March of 2023, the hospital where I was born, Bonner County General Hospital, announced it would stop attending births. The hospital said that it simply can't find doctors willing to staff an obstetrics unit in Idaho, which has passed punitive laws, making it easy to bring civil and criminal charges against doctors. With this closure, the nearest hospital with perinatal care is now at least an hour away. But many families in rural North Idaho are low income, lacking health insurance, and with limited access to reliable transport. For these families, the journey to the hospital might be as long as 3 hours in good weather and longer in a North Idaho winter. To put it simply, there are women and babies dying. Unfortunately, while Idaho's case is extreme, it's not alone. According to a Centers for Disease Control and Prevention report, maternal mortality rates in 2021 increased by 40% over the previous year across the US, and outcomes were uneven, as African women are disproportionately dying during pregnancy, which Jameela will touch on later. How is it that a third world country like Nicaragua has better maternity care than one of the richest countries in the world? The answer is that the Nicaraguan government has the political will to provide that care. Over the past 18 years, eradicating maternal and infant mortality has been a top priority that is carefully followed up at all levels. Recently, I was at the local public hospital where I live in Ciudad Sandino, just outside Managua. The director was ordering exams for a 19-year-old woman who was pregnant and very close to her due date. She had just returned from the United States, where she had been working but couldn't afford to see a doctor. She had no blood work, she'd had no ultrasounds, no prenatal care at all. She'd returned to Nicaragua where she could give birth safely for free without incurring debt, but she was returning as a high-risk pregnancy due to lack of care. The hospital director personally ensured that she was transferred to the maternity hospital in Managua for specialized care. For Nicaragua's healthcare system, a pregnant woman or baby dying is an unacceptable outcome, and healthcare workers at all levels take every possible measure to prevent it. The result of this is that no pregnant women have died in Ciudad Sandino over the past 3 years, and nationwide, only 21 pregnant women died in Nicaragua last year. Each death was investigated, and the details are all available to the public on the Ministry of Health website. Simply put, Nicaragua is taking every step possible to ensure that pregnant women survive to celebrate Mother's Day. As the Nicaraguan government statement on Mother's Day said, "Long live Nicaragua's mothers. May their love, our love, encourage us to be better every day. Mother Nicaragua brings us together." Thank you.
Barbara,
I'm so sorry.
There you go.
I did not unmute myself. Oh, let me repeat what I said. It's my pleasure to introduce our next speaker, Magda Lanuza, who is also a member of Casa Baltimore Limay, which I coordinate. She is a Nicaraguan serving as the project manager of Casa Arlen Siu, a maternal weight home, or Casa Materna in El Sauce, Department of Leon. She's trained as a research analyst and in that capacity has reviewed development projects across Nicaragua. Magda Lanuza, welcome. The floor is yours.
Thanks so much, Barbara. Thanks for this opportunity. Today, I'm going to talk of a specific project, one of those 201 Casa Maternas or Mothers' Weight Homes in Nicaragua. The name of this house is, of this home is Arlen Siu in El Sauce, Nicaragua, where Jameela was visiting and Becca last year in December. I want to tell, I'm going to talk today about the early stages of this project. Then it was a 2 years journey to prepare the systems and how the system is now, the services that are provided there, and why it is important to talk about these mothers' weight homes for maternal health and also newborns' health. This is a solidarity model working in maternal health in Nicaragua. It all started back in 2009, 2 years after the Sandinistas came back to power. And there was Dr. Matlin impacted by the fact that the Sandinistas have come back to power. In his project, long-term project on children's support since 1998, when the first the Matlins came to Nicaragua. But then in the 90s, all through the 90s, the government of Nicaragua, as Becca mentioned, there practically didn't fund health or education. So Dr. Matlin and his family took over the children's support, a children care center for preschool kids. But then 2 years after Sandinista came to power, the Sandinista government took over, the Ministry of Education took over the preschool named after Nimian Ortiz, Dr. Matlin friend in El Sauce. So the preschool was closed, and what to do? Dr. Matlin and the Matlins had some funds, but no project anymore because the Minister of Education took over preschool education. And there was Misa, Dr. Velázquez, by then the health unit director in El Sauce, who came to Dr. Matlin and said, we have a project, but we don't have money. Well, what we can do? And then she mentioned that there was a house in town, a women's organization that had shut down, had that house. And then where the pregnant women will come to the mother's weight home? Well, that was another question that couldn't be answered that early at the end of 2009. Then it took us more or less 2 years. By then, in 2009, there were left only in Nicaragua around 40 plus casa maternas. Some of them were private managed, but this one was like the start of a new public project. So the house was there and the conditions were not really good. So we had to work a lot to make a welcoming place for the women. Then furniture is expensive in Nicaragua and elsewhere. Well, MISA had some donations from the United Nations programs, and the Matlins other project, the Children's Center that was closed down, everything came to this building. Then how about workers? We need someone running the project. There were workers, women workers from the other Children's Center. Then the hospital director, by then Dr. Velázquez, said, well, I will be in charge, supervising, overseeing the management. I am on top of this project. Then something funny happened because we were struggling with watchmen. It was a women's health place in Nicaragua, as in many other countries. There are only watchmen working on those positions. And oh, they said, no, a woman never will make this job. No. Then the mayor said, no, why not? I have a candidate. Let's hire her. And she's still on working and doing wonderful job there. Also, the Ministry of Health worked with those trained nurses in maternal health, and they have been serving the mother's weight home until now. And then another problem came, where the pregnant women will come from rural areas. Well, the Minister of Health said, we have health posts out there. We have to try to recruit or encourage, because they were not used to come to wait sometimes for months or weeks or a few days when they are thinking that they are leaving behind smaller kids. So it was 2 years challenge to bring these pregnant women in. They were not used, they didn't want, their partners didn't want. How they will get there. Finally, the Minister of Health found ways to recruit or encourage and even bring them in the ambulances. Then in 2010, the Minister of Health of Nicaragua brought up the manual for mothers' weight homes to manage or to give guidelines to all the weight homes in Nicaragua. And then we participated in an event to draft and give feedback to that document that is nowadays an official guideline for all those 201 mother weight homes in Nicaragua. And it has been in use since then. So what systems do we have in place? We have three legs in this solidarity model. We have the mayor's office, the Ministry of Health, which is the local hospital, and then the matlins. The mayor's office, now they hire and oversee the workers, 4 workers in the home. They repair and make sure new furniture is brought in. They pay utilities and meals for 3 meals a day, plus snacks to all the ladies that come and spend weeks there. They provide all support for the entire operations of the home. Then the Minister of Health, there is a nurse that spends all day there from Monday through Friday. There are doctors doing the check-ins twice a day at the casa, at the home. There are ambulance services for free, taking the ladies, the pregnant women to the main hospital in Leon or this small hospital in town, and also to their communities. They also make sure that deliveries are safe and provide all medications pregnant women need. The matlins pay salaries of all the 4 workers, a cook, a coordinator, and the 2 wash women that they shift every other day. The matlins send the wires. Madre, an NGO based in New York, send the wires to the municipal office in El Sauce. Then the staff, the coordinator prepares weekly reports with all the data. The data goes to the Minister of Health, to the mayor's office, and also to the matlins and Madre. So this is a very strict way of monitoring and evaluating the impact of the work. There is a coordination. The matlins pays me as the coordinator and working with the MINSA and the local mayor and the workers. I do, and before the matlins also were doing 2 annual visits. And also we pay, the matlins pay for internet and cable services and other in-kind expenses to run the home. What kind of services are provided there? There is legal advice for the women who need, sometimes we have seen that there are teenagers coming here pregnant as a result of abuse. So the Minister of Family comes and provides legal services with the police. There are chats on women's health, women leadership, newborns health, other different topics on that area. Transportation is provided to and from Casa Materna to the hospital. There are daily check-ins inside the home. There are also care after deliveries. When mothers have had C-sections or other care is needed, they come and spend days or weeks there. Nutritious meals provided every day. Craft making, women come and learn how to make different crafts. Some of them are really good at and go back with entrepreneurship ideas. And they also have fun. They celebrate, Mother's Day coming up, or Christmas, and many other nice celebrations in Nicaragua. They have fun. Why to attend a mother weight home in Nicaragua? That's a question. Why why in a country where 40% of the population lives in rural communities. In El Sauce, the municipality serves 17 rural villages, and most of them are isolated. There is poor road construction and limited access. What happens in the middle of the night when one of these ladies get in labor? They cannot make it into town. It's important to save lives, to reduce maternal and early born deaths, and Nicaragua was really terrible before 2007. As Becca showed you, there has been a reduction since 2007 to 2024 of 79.8%, which is huge. And these mother weight homes have proven to be one of the best strategies to welcome rural women who are the most risk because they are the most isolated. There is no good access to their homes, to their villages. Malnourishment among rural women is higher than urban mothers. Also, young mothers, it's risky to deliver babies when they are terrible malnourished. Some of these mothers even come here and spend 2, 3, 4 months just to gain weight for them and the babies. And here we see that this solidarity model makes a huge difference in all the services provided in 201 mother's weight homes in all Nicaragua, but El Sauce is unique. It's the only project in Nicaragua with this model of solidarity running this project. The other mother weight homes are run only by the Minister of Health and the local mayor with limited capacities. They don't have a very well-trained and experienced staff. They don't have internet or cable TV. They don't have this great coordination for anything that happens. So this is a unique project among all the rest of mother weight homes in all Nicaragua. Solidarity is saving life in El Sauce. The matrons have proven that this is a great work, and sometimes we have seen generations, 2 or 3 mothers. There was one last year that came after her 4th child all these years. So if you have questions, comments, we are here.
Thank you so much, Magda. It's so inspiring to learn about your work and to see the level of women's participation at all levels of civic and political life in Nicaragua, particularly the health sector, as well as the institutional frameworks and the integrated approaches in place to advance both women's rights and the right to health in Nicaragua. That enable these programs to succeed, as you referred to as the solidarity model to healthcare in Nicaragua. So thank you so much again. Our final speaker is Jameela Alexander of Baltimore, Maryland. She is a co-coordinator of the Black Alliance for Peace, Baltimore citywide alliance, and a work-study member of the All African People's Revolutionary Party. She visited Nicaragua for the first time in March as a member of the Power and Protagonism Women in Nicaragua delegation, and she is a worker and doula who previously studied village midwifery in Ecuador. Welcome, Jameela. You have the floor.
Greetings, everyone. Thank you for having me here today. And thank you, Becca and Magda, for that amazing presentation. I want to talk a little bit about what I was able to witness on my most recent delegation, my first time visiting Nicaragua, particularly around the advancements for women, and then how that ties into the overall advancements for healthcare for women and children and their overall families. Then connecting that to what we see here inside of the US, particularly for African and other colonized people around healthcare. So this March, I was able to go to the Casa Arlen delegation for women's protagonism. in Nicaragua. And during this delegation, we were able to visit a plethora of different examples of being able to see the advancements for women, like I said, their families, and other aspects of the Nicaraguan society. One of the first places that we were able to visit was actually a hospital, a women's hospital. And inside the women's hospital, we were able to tour the different sectors that they had available for women. Not only were we talking about us care for any sort of what is the word I'm trying to use? Um, Investigations around your breasts or any sort of if you're having anything wrong with your uterus, any of these sorts of issues that you may see that smaller hospitals, particularly here in the US, may not have available. You were seeing at this beautiful state-run hospital, right? And inside of this hospital, you could see women that were sitting down. The director of the hospital was sharing with us how they have private rooms for people to be able to go into if they have any sort of abuses going on at home that's impacting them, their health, or their safety. They're able to report that to their doctor away from everybody, even if they came in with someone else. And these are particular things that, we hear a lot inside the US that we have available for women and children and men and everyone, right? But a lot of the times we see these things slipping through the cracks because of the way the healthcare system is modeled here inside the US. So that was one experience that really, really stood out to me the first time visiting because we don't have women's hospitals at all here in the US. We may have wings of hospitals that are dedicated to women, but we're talking about full service care and all those different things. No, we do not have that. And then when we were able to visit not only the Casa Materna and Alsace, but also we were able to visit a smaller hospital inside of one of the communities in northern Nicaragua. We were able to also witness this model of community coming together and learning about what it means to have consent, right? And what it means to take away someone's consent and how age is a big indicator and if someone can actually consent to even having relationships with other people of usually older ages, right? And we're sitting and we're watching this presentation happening and we're listening in, and the room is full of people of all different ages, different genders. There were older women with their grandchildren. There was an older man there with one of his grandchildren. And they come here to this hospital every month to participate in this sort of political education, right? So that they're able to understand the different things that are changing in the society that they live in, why it's happening, and why it's important that these things cannot happen anymore. And that really, really, really stuck out to me because a lot of the times inside of the US, we'll see a lot of laws or policies coming out where, okay, we're going to have Mother's Day, right? We talked about earlier on this presentation how Nicaragua's Mother's Day is not just word of mouth. They really, really show their appreciation for the women and the mothers of their society, not only on Mother's Day, but every single day of the year, right? Inside the US, you may see laws. You may even see a woman being the mayor or, the head of the city council or even the governor. But what are we actually seeing materially for the advancements of women inside the US? What are we seeing for the advancements of their families when people cannot afford to live? They can't afford to pay for their rent. They can't afford to pay for childcare. It was mentioned before inside of Nicaragua how childcare is available for your child before that they're even able to go into school for free. So you don't have to worry about if someone's going to take care of your child. You can be able to have your child taken care of, go to work, study, whatever you need to do to advance yourself. Inside of the US, we do not see these things, and we're not going to see these things because the US is not the particular society that's being built around the advancements of the people here. It is built around the advancements of capitalism, of imperialism, of domination, and really just taking advantage of every aspect of human life. So, connecting that back to Nicaragua, it was really, really important to see not only these beautiful programs for women and their family, but also the people that were running the programs were women, very, very highly educated women, young women, older women, women of all different ages, all different backgrounds across of Nicaragua. And we were on the Pacific coast. So we were really able to see the different demographics of Nicaragua as we were traveling around in the different healthcare sort of facilities that we were visiting. And it's just really, really important to understand that it's you can't just say something with words. It has to be backed by action, and it also has to be backed by education. I would like to mention that inside of the U.S., the particularly reported from 2023, the death rates for women, right, was down from 100 and, sorry, excuse me, 817 from the year before, which was 2022. And then in 2023, it was 669 women that actually died from childbirth, right? But it's really, really important to break down these demographics to understand that the US is not a society that's just based off one race or one cultural group or whatever. The society that the US is built around is a racial society. So you have to look at the actual people that are inside these demographics. If you break those down and you look at, for example, African people in the US, our rates are increasingly higher than any of the other groups that have been mentioned, specifically European descendant people, and also Asian descendant people. But it's also very important to understand that class has an impact on this. Particular people have more access to healthcare compared to others. Here in Baltimore City, where I'm from, African women, the rate of death for us, the highest rate of death is from childbirth. Baltimore City has over 5 hospitals. It is home to Johns Hopkins Hospital, which is a world-renowned hospital known around the world. So do we have so many women in the city dying from childbirth, right? It's because the system of healthcare inside the US, education, workers' rights, all these different aspects are not built around the support of the people, but to be built around the support of this empire. So it's very, very important for you to understand that all these separate issues are all interconnected. If you care about healthcare, if you care about women, if you care about education, if you care about immigrants' rights, if you care about anything that has to do with the advancements of human beings, you have to understand that the system that is supporting all of this is imperialism, and that is the main component as to why people are dying at such increasing rates due to childbirth. Life is supposed to be something that's celebrated and accepted, and Nicaragua has shown us that it cares not only for the life of their current citizens, but their future citizens as well. So I just wanted to wrap it up here at this point in time and just really encourage you all to visit Nicaragua for yourself, go on a delegation in Casa Arlen, do more research, bring yourself to more of a certain community model education around healthcare. Many of you all may be healthcare workers. Try to learn from other countries that actually won the things that we're trying to gain here. So you actually can see what we actually can do to help eliminate this genocide against our people. Thank you.
Thank you, Jameela. That was a very inspiring presentation also, as were the presentations by Becca and Magda. So I so much appreciate all three of you. Now we're going to turn to the question and answer period. So please do keep putting your questions in the Q&A box. I'm going to ask the first question, and then I'll alternate choosing questions from the Q&A with Natalia. Okay, so for my first question, I'll direct this to whoever would like to answer it, but I think perhaps Becca maybe to start. How do traditional and professional midwifery practices integrate into Nicaragua's healthcare system, and what impact do they have? I know you touched on that earlier, but if you'd like to augment it.
Right. So as Nicaragua's healthcare system is an inclusive model, it's a community and family-based model. And the healthcare system around the country works to work with families for them to take control over their own healthcare. They believe in empowerment. They believe in active participation of patients in their own care. Those healthcare, so many things, you try to impose healthcare on someone, it's not going to work. And one of those aspects has to do with midwifery, as well as with some of these other traditional medicine as well. So I hope you can hear me. It says it's unstable, but I'm trying to see how we can keep going. Okay. The midwives are integrated into this system. So rather than the Ministry of Health saying, we don't deal with midwives at all, what they have said instead is that they will incorporate traditional midwives and lay midwives into their system. So the Ministry of Health is training with those midwives. And what they've said to them is, instead of doing births at home as you have traditionally done, they train them about why it is unsafe to do those births at home, particularly in places that are so rural, where getting a woman to a healthcare center while she's in labor is difficult or sometimes impossible. And I think I would just touch very quickly on, Magda talked about the women coming into the healthcare center, to the Casa Materna, the mothering weight home in El Sauce. When Jameela and I were there, they talked about actually how far they have to go to get these women, and how far the women have to, they drive to a place and then they walk and they go on horseback. And to get these women in what is a relatively small area, it can be very difficult to access these homes. And so it's very important to get them out next to the hospital, near to the hospital, before they go into labor. I've heard stories of people being driven out in trucks and taken out in hammocks during labor, and that's very dangerous. So what the Ministry of Health says to the midwives is they train them, and then they say, right, your job is to look after the pregnant woman for her prenatal care. And you're to help her get to her prenatal visits so that she can get her ultrasounds and her blood work and all the other tests that she needs to have in the hospital system, and that she's registered in the hospital system. And then you need to get her to the maternal weight home. So it's the lay midwife's job to make sure to talk to the patients, to explain to them, especially because these are women who are the neighbors of these families, who probably delivered the person who they're talking to, probably have worked with the families for generations, and to say, okay, you trust me, your family knows me, I'm telling you now it's time to go into the maternal weight home, you'll be looked after there. And if the woman wants her midwife to be with her in the hospital, that is perfectly acceptable. She can have her mom, she can have her sister, she can have her midwife, she can have her partner. It is a humanized birth, they call it, within the public system. And so they try to let the woman come up with her own birth plan, and her idea of who she wants to be there and how she wants to give birth. And so the midwives can actually participate in the hospitals as well. I know that sometimes in the United States, it can be difficult for midwives to gain access to certain hospitals, to be able to be there in the hospital. But in Nicaragua, that's not the case. The midwives can be right there with the women during labor if she wants to. And they, of course, can do all the work prior to birth and labor and birth process with the patient. So they're really incorporated in at every step.
Natalia?
All right. So if there are no further comments on that, thank you so much, Becca. That was very interesting to learn about something I didn't know in that much depth, even when I visited Nicaragua. So we have another question here in the chat. What strategies are being used to expand the Casa Materna model from El Sauce to other regions of Nicaragua, and how can individuals or organizations contribute to scaling up this initiative?
You can take that, Natalia.
Okay.
Yes, that's a good question, because as I said before, this mother's weight home in El Sauce is unique in all Nicaragua. In many ways, there is somehow the sense that women here really come to rest. Some of these rural women, since they are 5-6 years old, they start working at home, fetching water, fetching firewood, cooking all the time, doing hand laundry in the creeks, in the rivers. It's incredible work. They only come to this home to rest, and they are served meals. They can have a nice evening walk in town, which is a luxury for most of rural women in Nicaragua. The rest of the homes, these mother weight homes in Nicaragua don't have that luxury because I said, you know, there are no workers paid. It has been very difficult for Nicaragua for the last years to bring in international aid or further funding towards these social programs. USAID left Nicaragua in 2016. There was a health project that we, Casa Arlen Siu, might have benefited from, and we still have those charts that were done by a Peace Corps volunteer, very useful charts on educating women on pregnancy and maternal breastfeeding, early born healthy babies. But that everything was shut down in 2016. And then the United Nations agencies have been dropping down also their support to Nicaragua, and individuals coming or funders, external funders coming to Nicaragua. It's very difficult. And we have seen that local people in El Sauce, they bring in donations. Sometimes they bring babies' clothes or bring cakes, or sometimes they bring materials for craft making. So we see more local people involvement, and it could be nice in the future to have, whenever I travel in Nicaragua and I visit other homes, I wish there could be another matlins helping them, because I definitely see the difference between this and the other ones. So there is not really a clear strategy nowadays. Sorry.
Becca, would you like to elaborate?
Yeah, I'd like to add on to that. I think that you know, the model that Magda is talking about in El Sauce, that three-legged model, is really wonderful because it also gives it a place for people outside of Nicaragua to plug in a little bit and get to know the system, which is unusual in the United States, but something that makes a lot of sense in the Nicaraguan context. And I would argue even in the context of places like Idaho, a Casa Materna would make a lot of sense. But there are now 201 of these across the country. So Nicaragua has 153 municipalities. That means that there's more than one Casa Materna in every municipality. We're quite a small country, so they are spread around, and there are different systems in each one. Some of them, like the one in El Sauce, provides after postpartum care as well. For example, in Ciudad Sandino, where I live, which is right next to Managua, the Casa Materna there doesn't provide postpartum care. They just do prenatal care. And even though it's in an urban area, a lot of our patients from our clinic live in an area that is dangerous at night. So you can't get a taxi out at night. So for those women, if they don't have someone in their family that has a vehicle, if they go into labor at night, they're not getting to the hospital. So they go to the Casa Materna. Also for women who are having, you know, a lot of times when there's relationship turmoil, when there's family violence, when there's issues, it is much better for that pregnant woman to be in a safe place where she's looked after in a hospital setting right before giving birth. So as Magda mentioned, there's different services available, and there's some Casa Materna, like the one in Matagalpa, that has a birth area in it, so that women not only do their prenatal and postnatal care there, but they actually give birth in the center unless they're a high risk pregnancy, in which case they go to the regional hospital a few blocks away. So each one is a little bit different. I think that a really interesting way of trying to connect people and trying to help other folks, individuals or organizations who want to become involved, is, you know, yes, there's obviously room for that because there's so much that can be done through these Casa Materna. And one of the things that our organization is working on, there's a group that is working with mothers with young children who need an income, to teach them how to make new mother's bags. So it's a cloth bag, and into the cloth bag goes materials that have been purchased locally, like diapers and a few clothes and some hygiene items for the baby, and a book for the baby to read to the baby. And we have a lot of interest from folks in the United States in helping pick out material for these bags, helping teach how to make the bags, and helping cover the cost of the things that go in those bags, because especially people really get inspired a lot of times, being a mom or having gone through the process themselves, want to help other moms, and that can be a good way to get people connected. And our goal is to provide some other bags for the 400 women that are seen in our local Casa Materna. But of course, there are hundreds and hundreds seen every year at all the different Casa Maternas. So there's lots of rooms for things like that that might provide some connection between women in other parts of the world and women in Nicaragua.
Oh, some good ideas there. Okay, for the next question, this is from Barbara Stewart. She asks, are there rural child care centers capable of caring for existing children while mothers are at the casas maternas? How is this handled?
That's one of Barbara. Can I?
Yes.
That's one of the biggest challenges, because these rural mothers, they are the ones who have more children in Nicaragua, sometimes 4, 5, 6, and when they are frightened to leave behind the smaller children back at home. Sometimes they don't have partners, and they have to ask neighbors or family members or their mothers. So it's very, very, it has been a challenge to bring in women with multiple smaller children. And there was once the idea of the Minister of Health to bring in the pregnant mother with their smaller children. But then it was a bigger challenge for the home in El Sauce. So there are those places don't exist in rural areas, where in urban areas, yes, there are the preschool or maternity homes for the smaller babies to preschoolers, but not in rural areas. So that's a big challenge, and sometimes just pregnant women are so reluctant to come to a casa materna to wait there for sometimes 2 months when they have a toddler back home, and they are always anxious what's happening, who is taking care of them. So that has been since the early days, was one of the biggest challenge, to think about their smaller ones and spend weeks and days, because sometimes they have conditions that doctors prescribe them not to be just the 2 weeks before the delivery. Sometimes they have to spend there a month. Last 5 years ago, we had someone who practically spent all her pregnancy, almost 6 months there, because she was so malnourished that she needed to eat and rest, and 5 months in that place she spent all together. So that's one challenge that rural pregnant women have in Nicaragua still.
The revolution is ongoing, right? Yep. Okay, well, thank you, Magda. And any other responses from anyone on that? Okay, Natalia?
Okay, thank you very much. So I see an interesting question here in the chat about from Catherine. I'm seeing some connection here between Cuba and Nicaragua, especially the integration of midwives into the system and maternity homes, as well as medical school training at ELAM. Would someone like to take that question?
I can speak to this a little bit, but Becca got me on the back end. Yeah, Cuba actually was a huge part of helping develop Nicaragua's medical system, training very early on doctors at Elam, for example, switching doctors back and forth between both countries so that they could get the adequate training that they needed and going back. Many of you on this call may know of Cuba's program where they send their doctors around the world. Nicaragua was one of the countries where that is continuously happening with, and Nicaragua and Cuba have very, very close relations, not only diplomatically, but with inside of their revolutions. So they're both socialist countries, so you're going to see the similar models because they put their people first. Um, you know, it's really important to understand that this is what healthcare is supposed to look like for all of us. And we have not one, not two, but three countries in this region that are in the process of developing their healthcare to be the best in the world. So I'll yield there.
Thank you, Jameela. Would anyone else like to add anything?
I think that this system, it's about thinking about the people, thinking about the future generations, and still Nicaragua has a high birth rates, which is still important. It has been decreasing lately, but still in rural areas is huge. And investing in the future of our country and saving lives of women and small children has made a total difference in the entire health system. And the Nicaraguan health system has a community approach, which is also has, you know, the roots and all the background from the Cuban health system. And still, things are different in both countries, but we share many of the systems that have proven to work with a preventive approach. We try to prevent illnesses, not to cure, not to spend big budgets treating patients or very ill patients, but to avoid illnesses from the very beginning, spraying the mosquitoes, trying to get volunteers in the community involved. Even in these maternal health programs, the community is involved. Everyone takes care of. When they see a maternity home, people stop by, and sometimes they said, if you need a vehicle, because ambulances are not, we don't have tons, we don't have as many as we wish. And so we have people trying to look around and take care of those pregnant women and the small children. So this is, you know, fabulous, because it's all the community and the authorities and leaders taking care of the future generations.
Becca?
Doesn't directly relate to Cuba, but I did want to add on, because Magda mentioned the birth rate, that in Nicaragua, in this second period of the revolution, there's been in the public healthcare system a lot of focus on family planning and women taking control and being able to plan their families as they like and have as many children as they want. If you talk to women who were in their childbirthing years in the 1970s in particular, and you ask them how many children did you plan to have? And they said, I had as many as God gave me, because there wasn't family planning available. And you wind up with a lot of families with, 9 children, 7 children, even more. And what we see now is that the Ministry of Health talks to women about family planning, so that when they go into the hospital to give birth, they leave that hospital with their family planning, already taken care of. So are you going to have an IUD? Are you, how are you going to be taking care of your family planning to make sure that you don't get pregnant before you want to? And that's really important. And it's all free. There's all kinds of methods. There's IUDs. There's also free tubal ligations. There's, of course, injections and pills. And now new for young women in Nicaragua, if you're under 19, free are the subdermal implants. There is a lot of demand for the subdermal implants, and not as many as we would like to see being placed, but it is something that the government is working on providing, and that subdermal implant works for 5 years. So that's a particularly good method for young women and in particular, young women who haven't yet had children. If you think about it, if you put in an implant and then you get 5 years out of it, that's long enough for you to go finish high school or college even, depending on how old you are. So that's really important. And I think that that's along the line of prevention, is making sure that there's not, that women have access to the family planning they need for free so that they don't wind up with an unwanted pregnancy.
Well, I see that we have used up all of the questions that were entered in the Q&A, and we've heard several excellent presentations as well as answers to some of your questions. So I think at this point, maybe we'll just ask each of the speakers for any final remarks that you may have, and then we'll thank everybody for attending. Perhaps we could go in the same order that you already spoke. Becca, then Magda, then Jameela.
Sure. I think that, it's been mentioned several times, and I just want to underline that, the reason that Nicaragua was able to do this is because it has the political will to do so. Why can't the United States provide free health care for all of its people? Because it does not have the will to do so. And so, Nicaragua was able to do these things, and it's not easy to provide free health care and to continue improving it, let alone provide this quality of care. That means that we really have been able to reduce maternal mortality rates by almost 80% over 18 years. It's pretty incredible gains. And I also just want to underline that the Ministry of Health and the maternal wait homes in particular provide integral care for women. So Magda mentioned this as well. It's, there's all different aspects of the women's health is being looked after. But it's not uncommon for a woman, in particular a woman who lives in an isolated rural area, to come into one of these homes, and then for the staff there to find out a lot of other things that are happening in this woman's life that are putting her and her baby and perhaps her other children at risk. Sometimes you find out about family violence, sometimes you find out about unsafe housing issues, sometimes you find out about mental health issues. And so the staff at these maternal wait homes and the medical staff, and also the staff that are provided usually by the mayor's offices for those maternal wait homes, are trained to try to help connect those women. So they might bring in a social worker, they might bring in a psychologist, they might bring in the Ministry of the Family. There's a lot of integration connected together. When Jameela was visiting Nicaragua, we got a chance to talk to folks at that are in charge of the women's police stations. Nicaragua has over 300 police stations that are staffed by women police officers that deal with family violence issues and take reports from women and children. And all these institutions work together in an articulated fashion to be able to provide this integral care for people, in particular for women and families. And so this is typical of everywhere, including the women's, mothering wait homes, including hospitals, that when you see something that is happening and someone has a need for what we could call a social prescription, not just their medicine, but also they need someone to come, and talk to them about the violence that's happening in their family, someone to come and help them deal with the housing issue or with the food insecurity issue. Then you bring in these other institutions. You can bring in the Ministry of Health, you can bring in the Ministry of the Family, you can bring in the Ministry of Women to help take care of these folks. And when they find a family where there's a woman that is experiencing violence and she and her children are in danger, they don't just leave her alone. They make sure they know, look, if she doesn't have any way of economically supporting her kids, then she's never going to be able to be free of this abusive partner. So how can we help her to become economically independent? That's why, in part, at the Casa Materna in El Sauce, they work on these, like, let's learn to make piñatas and do these other activities, because it gives you a skill that you can use if you need to look after your family. And that's, I think, something that's very impactful all over the country, is this consistent working together among these different institutions and organizations to try to meet all the needs of these women, and not just taking care of my part and ignoring the rest of the person who is here in front of us.
Thank you so much for being here today. And I have been wondering how many mothers are here today. in this webinar, mothers or grandmothers, and also women who are interested in women's health. And Nicaragua is still a very poor country that still faces the terrible impacts and legacies of civil wars, US interventions, back dictatorships, and violence from decades. He has been recently rebuilding all the social development, but now in this century facing tremendous challenges because now we are facing sanctions. And that is upholding a lot of EU foreign funding or from multilaterals and also private funders, and governmental programs from abroad are not supporting these excellent social programs that are just bringing up saving lives and also making sure that our country has a better future generation. So with the smaller efforts that the Nicaraguan authorities and the willingness of local people and the local mayors, these type of programs are possible. And we have the data, we have seen the huge advancements Nicaragua has made on maternal health, reducing childbirth mortality rates. And this is a commitment, a life commitment. And with solidarity, I think we can make the difference in those countries, those nations around the world suffering. They deserve to live in peace. They deserve to have a better future and have better living conditions. And Nicaragua is struggling for that, besides all the odds that Nicaragua nowadays is facing. Thanks so much for being here.
Okay, I'll just wrap it up saying that it's really important for us to stay in tune with what actually is happening around the world, particularly inside of Nicaragua. So please visit the nicasolidarity.com website to stay up to date on what's going on. I would like to encourage everyone on this phone to look at this as a step more than just solidarity, but to see the Nicaraguan people and ourselves as one. And that our struggles are interconnected, and that it's when we're fighting for the advancements of the Nicaraguans against these horrible sanctions, against these lies from the UN and all these different nonprofit groups and different other religious affiliations, we have to understand that we have to search for the history and the actual truth of these things on our own. And when we do that, we have to understand that it's more than just lip service. We have to materially contribute to the advancements of our movements around the world. You can visit Nicaragua. You can support Casa Maternas. You can support the different delegations that put money into the pockets of the people that work inside of these communities that we have heard about today and that we will see on these different webinars that we see monthly. But it's very, very important for us to put that inside of our hands, to not see ourselves as some sort of savior, but as people that are engaged in the struggle along with everyone else. So yeah, I just encourage us to look at Nicaragua as a model for all of us, a model for us to learn from, a model for us to support. And yeah, let's leave this call with understanding that there are places around the world that actually do put the people first. And we can be just like that too.
Wow, those were wonderful final remarks from everybody. Natalia, would you like to offer your own comments?
First of all, thank you all so much for joining us. I learned so much from each of you. I think when I first went to Nicaragua, it was very inspiring. Like Becca and Jameela, I went on the first Women's Brigade to Nicaragua, and we saw firsthand, we visited those casas maternas, and we saw firsthand how this integrated approach to both women's rights and the right to health is being realized in Nicaragua, despite everything, despite all of the adversities that Nicaragua still faces. Like we said, US sanctions, all sorts of attempts at foreign interference and destabilization in Nicaragua, and yet Nicaragua is able to accomplish so much with relatively so much less monetary resources than the US, and that really speaks to the success of Nicaragua's healthcare system, of a healthcare system, like everyone said, that puts the right of women and the right of everyone in front of the interests of profit. So we see how that is actually exemplified in Nicaragua despite everything. So thank you all so much. I learned so much from all of you, and I hope everyone else enjoyed this webinar.
Thank you.
And yes, and I want to just echo Natalia's remarks too. I really appreciate all of these presentations. And a couple of you in your final remarks also mentioned how we are all so connected and we need to see each other as connected across nations and also across some of our adversities that more and more we are facing collectively. We're all under sanctions in our own ways, regardless of whether we're in a so-called third world country or first world. We see more and more clearly what's going on. And so let's join together to continue building a more beautiful world and use Nicaragua as one example of how to do that. Okay, thanks everyone for attending, and I guess we'll bid you farewell now. Bye.